And its spread in hospital protocols. We're joined now by Dr. Elaina George, an expert on healthcare delivery. Thank you so much for joining us.
It's a pleasure to be with you.
Should there be a mandatory 21-day quarantine period everywhere? Why does it seem that we're seeing healthcare workers who are going out and about, they've had contact with patients? We have this newest case in New York, and then one of the cases with a nurse in Texas who flew after she had contact with an Ebola patient. Is there a protocol problem?
I think there is. I'm very happy to hear that New York is now upping the ante and actually really quarantining folks who are coming back from these affected countries. The problem is the incubation period makes people think that they're not infected, and they can go around just like this doctor did, where they could potentially expose other people to the virus. And I think an ounce of precaution is worth it. This is not something that you can go backwards and then say, I should have. It's appropriate to take as much precaution as you possibly can. We're not telling people that they can't fly back and forth, but it's good sense to really quarantine them and not self-quarantine, but have a real protocol in place, just like New York just announced.
Why aren't more governments and more places doing that? Because it seems like it would actually be common sense to have a mandatory quarantine. If you've had contact with an Ebola patient, if you've been treating someone, then maybe you shouldn't travel or be around other people for a while.
You have no argument from me on this at all. I absolutely agree with that. I actually don't understand why this hasn't been put into place. The World Health Organization has been on the forefront of this, and they've said specifically that there's 98% of the people will have an incubation period between 21 and 42 days. And to just let people who you know have been in contact with Ebola victims, it makes perfect sense. They are potentially bringing, they're doing the good thing. I'm not saying that they're not, but they're bringing something back potentially into the country that becomes a bigger health risk. Now we have more people that need to be, followed and monitored and possibly quarantined. And if we were more proactive about this, we wouldn't have this level of anxiety.
I want to ask you about a recent survey. The Association for Professionals in Infection Control and Epidemiology released results of more than 1,000 of its members. About 6% of them said that their hospitals were well prepared for Ebola, while another 5% say that their hospitals are not ready. Want to get your thoughts on that?
This is a work in progress. I'm a physician. I see patients every day, and to this point, I have not been contacted by my home hospital or the CDC about how to protect my private practice. So this is basically people kind of working on their own and hoping that we'll get some basic, tenets in place that can protect both independent doctors as well as hospital workers. It should be better organized, I have to say.
I want to get your thoughts on the possible new vaccines coming out very soon. Is there a sense inside the medical community with news of new vaccines being ready for testing by the end of the year? Is that too soon, or what's the risk for flooding the area with just these untested vaccines for Ebola?
Well, this is definitely a risk-benefit. To put them out, they're actually going to have to test on the fly, and they're running actual phase 1 and phase 2 trials on people who have Ebola. And I understand why you have to do it. There is just an onslaught of this disease in Africa, and that's where they're going to try to concentrate first with the healthcare workers. But ultimately, we don't know. We won't have any long-term follow-up. We'll have to see how it goes. And ultimately, it's all now about prevention, and it's about quarantining. It's about decreasing the risk of exposure. And for people, taking care of themselves so their immune system is as primed as possible so they can have some sort of resistance to this.
All right, Dr. Elaina George, thank you so much for joining us from Atlanta.